Understanding the intersection of blood sugar management and menopausal health, the provided list of topics highlights a critical overlap in women's health. The complex relationship between hormonal changes during menopause and metabolic health, specifically regarding blood sugar regulation. While menopause and type 2 diabetes are distinct conditions, they share several physiological symptoms and lifestyle challenges that can exacerbate one another. The shared symptomology. Sweating and temperature regulation. One of the most striking connections between these two health phases is the experience of sudden, intense sweating. In menopause, women frequently experience hot flashes and night sweats. These are primarily driven by fluctuations in estrogen, which affects the body's internal thermostat, the hypothalamus. In diabetes, excessive sweating can be a sign of hypoglycemia, low blood sugar, or, conversely, a complication of high blood sugar levels. Why this matters? Because the symptoms sudden heat and perspiration can look identical, distinguishing between a hormonal hot flash and a dangerous drop in blood sugar is vital for effective management. The blood sugar connection. Hypoglycemia and spikes metabolic stability is a cornerstone of health, yet it is often disrupted by both diet and hormonal shifts. Reactive hypoglycemia and dietary triggers consuming high amounts of carbohydrates or sugar can lead to reactive hypoglycemia, where the body overproduces insulin, causing blood sugar to crash shortly after eating. This often manifests as shakiness or tremors before meals, sudden bouts of sweating, dizziness or weakness. The dawn phenomenon and nighttime regulation. Blood sugar management is not just about what we eat, but how we sleep. The dawn phenomena, rise in blood sugar in the early morning hours, and the struggle to prevent high blood sugar at night are significant hurdles for those managing diabetes. The sleep paradox. Insomnia and metabolic health. Both menopause and diabetes present significant challenges to restorative sleep, creating a difficult cycle for the patient. Menopausal insomnia. Driven by night sweats and hormonal shifts, sleep disturbances are a hallmark of the menopausal transition. Diabetes and sleep. Blood sugar fluctuations can trigger nighttime awakenings, while poor sleep quality can, in turn, make blood sugar harder to control. The cycle of disruption. Poor sleep can lead to insulin resistance, which raises blood sugar, which may then cause further sleep disturbances through nighttime glucose fluctuations. Managing the transition. Practical approaches to navigate these overlapping health concerns. Several strategies emerge from the current medical discourse. Nutritional interventions, stabilizing glucose, identifying best and worst foods to avoid reactive hypoglycemia. Hormonal support, utilizing specific foods that may help mitigate the intensity of hot flashes. Avoiding triggers, reducing sugar intake to prevent both metabolic spikes and the physical discomfort of sweating. Lifestyle adjustments, exercise caution. Recognizing that while movement is healthy, high-intensity exercise can sometimes trigger hot flashes in menopausal women. Sleep hygiene. Implementing specific routines to combat insomnia, whether caused by hormonal shifts or glucose instability. Conclusion. Managing health during menopause and type 2 diabetes requires a holistic view that connects hormonal balance, dietary stability, and sleep quality. By recognizing that symptoms like sweating and insomnia can stem from multiple sources, individuals can better coordinate with healthcare providers to address the underlying metabolic and hormonal causes.